Good day to everyone. Today I am tasked to present the current situation of the Philippine health sector, the directions in this medium term, and the priorities of the Department of Health. For more than 3 decades, the health sector has been devolved. Since 1991, our health sector has been individually managed by local chief executives, with the Department of Health's role being focused on national policy development, capacity building, and regulation. In the recent decade as well, we have seen more Filipinos access health services in the private sector compared to the public sector. Many findings point to the structure of the Philippine health sector as a driver of the incremental progress of the country's health system. The complexity of our health sector prompted the enactment of Republic Act 11223 or the Universal Healthcare Act of 2019. Its objective include the progressive realization of UHC through a systemic approach and clear role delineation. It also aimed to ensure equitable access to quality and affordable healthcare and protection against financial risk. As we entered this new administration, we reviewed some key statistics, and here are what we found. In terms of health outcomes, most have regressed, and it has been attributed to the pandemic. While we see some improvement in children's nutrition, the latest statistics still show one-fourth of children under 5 being stunted. In terms of health system capacity, we found that there are actually less provinces with adequate beds to population, as well as midwives to population. While for nurses, there has been an increase by only 5 percentage points. In terms of financial protection, we found that despite exponential growth in terms of budgetary outlays, the proportion of health expenditures covered by PhilHealth declined from 18% to only 14%. This may be part of the reason that shows one-third of inpatient Filipinos having experienced catastrophic health spending. In summary, we see mixed progress in addressing the health challenges in the Philippines. 5 years from the enactment of the UHC law, are there any gains observed? With this question, we may look at its implementation using the UHC cube. For population coverage, because of the UHC law, as long as you are Filipino, you are automatically covered by the social insurance. However, notice that the registration rate is only at 96%. While this has improved, it still means that 6 million Filipinos are still to be found and registered in the PhilHealth system. For financial coverage, we see that out of pocket spending has decreased from 48.8% to 44%. However, notice that what drives the decrease in out of pocket may actually be the expenditures of the DOH, which has increased from 11% to 19%, while that of the social health insurance have declined from 17 to only 10% as of 2023. For service coverage in terms of UHC Service Coverage Index, a WHO measure that makes countries comparable, it only shows the Philippines having service coverages at an index of less than 60 over 100. This brings us in the lower half in the Southeast Asian region, in Asia, and in the rest of the world. An example of what comprises this index would be immunization and TB treatment coverage, which shows an incremental improvement given a 5-year comparison. These are just some of the 14 coverage indicators comprising this index. In terms of UHC, our conclusion is that 5 years from the enactment of the law, the implementation have come a long way, but there is still much work to do. In understanding areas within the system that needs further improvement and to result in better outcomes, the DOH commissioned the first national universal healthcare survey. For this, we commissioned ID Insight Philippines, who implemented a nationally representative survey among active UHC integration sites or in areas whose LGU have signified their intent to integrate their local health system in line with the UHC law. The survey included a household survey, a facility head survey, and a healthcare worker survey. On the right of your screen are the dimensions of the survey. Let's look at the results following these dimensions. On UHC governance, we find low awareness of UHC at only one-fourth of the respondents, and even with those with awareness, one-third cannot name any of their benefit. There is also very low awareness of the primary care benefit package called Consulta at only one-fifth of respondents. Word of mouth is the primary source of information about UHC, PhilHealth, and Consulta. Those shaded in yellow are facility access points, which is a top source of information. On the implementation of the National Health Insurance Program, while PhilHealth reports 96% of the population being registered, this survey show only 74.5% of patients knowing they are registered. A possible explanation for this is that some are registered as dependents but unaware of their actual status. It is, however, notable that 15% uh, registered respondents did their registration within the last year. It was also found that the PhilHealth support value is only at 27%. This is consistent with the low PhilHealth expenditure in the health accounts. On primary care and accessibility, while it is notable to find 71% of facilities already Consulta accredited, it was found that there is small registration rate at only 11%, and more so on actual utilization of this benefit at only 6.8%. It was found that there is confusion on the stakeholder main who is mainly accountable in ensuring demand for this benefit. We also found that gatekeeping from primary care facilities remains limited. Of patients attended hospitals and specialist care without any referral. On the patient side, the main reason for bypassing primary facilities are because of proximity, familiarity, and primary facilities usually not having comprehensive set of goods and services. Meanwhile, on the facility side, we see that facilities struggle with the referral system due to poor coordination between facilities, as well as overcapacity of receiving facilities and the slow referral process. Back to the National Health Insurance Program implementation, we found high compliance to no balance billing policies in government hospitals, both as reported by patients and the head of facilities. However, we found that the no copay payment policy for patients in basic accommodation is only 80% as reported by patients and only 64% as reported by facility heads. The reason this takes place is because of the report of patients not knowing their entitlements and their inability to comply with the requirements. We also found areas for improvement in the system for payment in PhilHealth, where we found that almost half of primary care facilities and one-fourth of hospitals have not received any expected capitation payments. Among the reasons for this include delay in PhilHealth processing and the difficulty in verifying patient enrollment. On human resources for health, of the total healthcare workers surveyed, we found that half of all health workers have plans of leaving their place of work. while 5% have definite plans of leaving the facility. 19% have considered leaving the facility and are actively exploring, and 23% have considered leaving but are not actively exploring other opportunities. Of the 5% you see on your screen who are definitely leaving, we found that around half are going to work in another country, while more than one third are shifting work within the health sector. The top reason for health workers wanting to leave their facility is poor compensation. However, we also found two factors that have correlation to their intention to leave. These include burnout and their report of not having a fully supportive working environment. On quality, we found that generally Filipinos are satisfied with the health system. This may be explained by the general lack of benchmark or comparison to other health systems. In terms of responsiveness score, Filipinos only rated poorly in their experience of the basic amenities, such as comfort rooms and waiting areas, as well as their choice of care providers. On financial risk protection, in this survey, we found that patients that spend more than 10% of their 6-month household income, or what we call catastrophic health expenditure, happens exclusively among inpatients and in private facilities. This is one fourth of all inpatients in private hospitals. Finally, back on UHC governance, we found that there is little correlation between reported and validated local health system maturity level with the implementation progress and outcomes experienced by Filipinos. For example, based on facility head reports and the latest LHSML report, implementation of EMR and e-referrals was higher on average within LGUs with lower percent KRA achievement. Let us now look at the sector directions. Specific to the findings of the UHC survey, DOH units have identified the following response. On UHC governance, we are to implement the communication plan for UHC and also to shift UHC integration site monitoring to performance and quality management. For the National Health Insurance Program implementation, to simplify the registration process, to maximize demand for primary benefits, to develop mechanisms to ensure no co-payment policy implementation in private facilities, and to improve PhilHealth system for efficient facility payments. For primary care and accessibility, we are to designate a primary care focal in the Department of Health to focus DOH support to primary care service availability and to ensure the contracting of healthcare provider networks. For human resources for health, to accelerate or scale the HRH master plan implementation. For quality, to implement the national quality policy and strategy for health in all levels of the health system. And for financial risk protection, to accelerate improvement in benefit packages. All those recommended responses to the survey are actually, in a way, covered by this administration's strategic policy framework called the 8-Point Action Agenda with the tagline, Sa Bagong Pilipinas, Bawat Buhay Mahalaga. Before we go through each action agenda, something to emphasize here are the three cubes that house each action agenda. That is for each Filipino, each community, and each health worker and institution. Essentially, the Secretary of Health wanted us all to ensure that within this administration's term, there is felt impact for each action agenda as laid out for these stakeholders. Now, going through each agenda, Action Agenda 1 is on every Filipino experiencing health and well being, with the objective of mainstreaming and strengthening the primary healthcare approach, ensuring that every Filipino has access to comprehensive health services without experiencing financial hardship. Action Agenda 2 is on safe, high quality, and people centered services. The objective is to ensure the provision of high quality, safe, and people centered services, which include access to affordable medicines across the life stages. Action Agenda 3 is on technology for efficient health service delivery. The objective is to leverage digital health and technology for efficient and accessible health service delivery. Action Agenda 4 is ready for health crisis and emergencies, with the objective of ensuring a responsive and resilient health system and communities that can effectively prevent, prepare for, respond to, and recover from public health emergencies and crises. Action Agenda 5 is disease prevention and health promotion, with the objective of addressing determinants of health and improve healthy behaviors through the promotion of health enabling settings, implementation of healthy public policies, and enhancement of health literacy. Action Agenda 6 is mental health and overall well being, with the objective of enhancing Filipinos' well being and ensuring quality mental health services. Action Agenda 7 is the advancement and protection of health workers' rights and well being, with the objective of ensuring adequate, competent, and committed health workforce by providing fair compensation, decent work conditions, and opportunities for career development. Finally, Action Agenda 8, that is protection from pandemics, with the objective of strengthening health systems and structures to prevent, manage, and recover from disease outbreaks and potential pandemics. As a bedrock to all of this action agenda, the DOH also adopts a humanistic approach to leadership. This approach enhances the leadership and management skills among DOH and LGU public health institution leaders, making it service driven and people oriented, as well as good governance, pursuing these action agendas through strategy, performance, and quality management systems. The DOH have also issued the National Objectives for Health, which provides in detail the objectives, the strategic interventions, as well as the monitoring and evaluation plan for the sector in this administration. This health sector strategic plan expounds on Administrative Order 2023-0015, which is the 8-point action agenda. And in addition, in support of this, the Office of the President also issued Memorandum Circular number 53, which mandates all national government entities to support the plan. Both these issuances, AO 2023-0015 and MC 53 series of 2024, encourages LGUs to support its implementation. With the objective of ensuring health stakeholder alignment, we analyzed 224 indicators, which are the performance commitments of the 20 current foreign assisted projects implemented by our 14 international health partners. Here is what we found. Majority or 48% of our FAPS commitment are aligned with agenda number 2, which is focused on service delivery and includes major programs such as tuberculosis, HIV, and maternal health. This is followed by FAPS being most aligned to Agenda 5, that includes health promotion, 6 for mental health, and 8 for health security, but that is only 8% each. Current FAPS also somewhat support Action Agenda 7 for health workforce, also 1 on primary care, and Action Agenda 3 on digital technology, as well as 4 for health emergency, but with minimal alignment. We notice also that around 12% of commitments are dedicated to COVID-19 response. In summary, there is areas to improve alignment on directions for primary care, non-communicable diseases, health promotion, mental health, health workforce, and climate change. Now, as an organization implementing a performance governance system, the DOH identified where it wants to focus its resources for relevance and higher impact during this administration. I'll be presenting now the strategic focus of the Department of Health and its priorities. As an added context, we looked at the following statistics. First, from the NDHS 2022, where it was found that 3% of Filipinos sought health services in the last 30 days. It was found that majority of them actually go to a private facility, and those that access the public sector would bypass primary level facility. Notice here an almost equal proportion of access. Then we also talked about where would Filipinos be at usually. So we found that most, of course, of Filipinos would be in schools and in workplaces. So that's around 53% of them. We also looked at a statistic in the NDHS that mentioned that three-fourths, around three-fourths or 66% of Filipinos who sought care, they already need confinement. And when we looked at this study from PIDS, they found that one-third of all of these confinements in hospitals are actually due to ambulatory care sensitive conditions or conditions which necessitated confinements because of poor primary care services. So all of this informed our secretary as well as the executive committee in identifying the Department of Health's strategic focus. So their decision is to focus our resources in guaranteeing access to quality primary care in all settings. The DOH also expressed that it would focus its resources in attaining the following in this administration. So there are 8 priority outcomes. Number 1 is increasing the proportion of fully immunized children to 95%. 2, decreasing or cutting in half stunting. 3, returning the level of maternal deaths to pre-pandemic levels. Number 4, increasing the percentage of population with access to safe water to 100%. Number 5, ensuring that there is zero deaths from tuberculosis. And corollary to this is increasing HIV/AIDS prevention and management. Number 6 is to decrease death rate attributed to road injuries into half. Number 7 is to increase the coverage of hypertension and diabetes mellitus management. And 8, to increase early detection, screening, and treatment for cancer. And then cross-cutting would be to ensure digitalization of health services. So how does this compare or relate with the national objectives for health? These 8 are actually a subset of the national objectives for health. So the 8-point action agenda and the national objectives for health are health sector-wide directions, while these are the focus of the Department of Health. So in alignment with the focus, which is quality primary care in all settings, looking at the national objectives for health, we called out the following. Here are the primary care commitments of the Department of Health. So number 1 is to increase primary care facilities that are consulta accredited. 2, to increase Filipinos with first patient encounter in a consulta accredited facility. 3 is to add 600 more primary level facilities. 4 is to increase primary care facilities with interoperable EMR for service delivery. 5 is to increase LGUs with at least one team of certified primary care workers. 6 is to have functional and contracted healthcare provider networks. Another is to increase LGUs with evident Dream H for large scale health emergencies. And finally, to increase the number of LGUs with functional epidemiology and surveillance units with access to the public health laboratory system. So these are mostly health system centric. In accordance with the settings approach, we are also to ensure that schools are healthy certified as well as workplaces. In support of primary care, the Department of Health also launched two flagship programs. These are one, the Bagong Urgent Care and Ambulatory Service Centers to cater to the vulnerable population, providing them with urgent and ambulatory services without compromising hospital capacity. And another is Puro Kalusugan, which aims to implement a door to door service delivery focused in the priority health outcomes of the Department of Health. This is my last slide. This figure emphasizes the stewardship role of the DOH as it orchestrates the various health stakeholders in alignment with the guidance that we have, beginning with the vision, our commitment with the Sustainable Development Goals, and the strategic policy and plan laid out by this administration in the Philippine Development Plan in the 8-point socioeconomic agenda and its translation to the 8-point action agenda and the national objectives for health. We would need all the support to ensure systems and processes are in place for a whole of government and whole of society approach to health and development. Thank you very much for this opportunity and for your attention.